everyone joining us this evening. We just ask that you keep your video off for the presentation and your microphone as well. We're just going to take a few minutes to let the rest of our registrants make their way into the room, and we'll get started shortly. Okay, let's get our evening started. Thank you again, everyone, for joining us this evening. If you have any questions during our panel, please type them into the chat area, and we'll have our panelists answer them following the discussion. If this is your first LGBTQ alumni and allies event, thank you so much for joining us in this virtual space. To the alumni joining us for the first time, I'd like to introduce you to both Marlon Alto and Brendan Donahoe. They first approached the Alumni Relations Office with the idea of creating this network and have been really instrumental in help building it. Marlon, would you like to just introduce welcome our?
Sure. Hi, everyone. Thank you so much for coming. It's a pleasure to see so many of you. It's a pleasure to see you, Michael. Second LGBT Baroque event of the day. So thanks for showing up. Appreciate it. Yeah, and so I and Brendan, I think, concurrently had the idea of bringing LGBTQ alumni together and create sort of network. And I don't think there's any time better than now with all that's happening for us to be there to support one another and share ideas on how we can be resilient through these difficult times. And so thank you so much for being here. Bye.
Thank you, Marlon. So let's introduce our panelists for the evening. Our first is Noam Mendel. He is a senior vice president at Citi, working in model risk management. Noam earned his BS in electrical and electronics engineering from Tel Aviv University and an MS in financial engineering from Baruch College. Noam's team is responsible for activities that include updating and maintaining the global model risk management policy, interfacing with regulators and internal auditors, training, quality control and assurance, and independent review and challenge initiative support. Thank you for joining us today, Noam.
My pleasure.
Our next panelist is Alex Matthew. Alex holds a BBA in Finance and Investments from Baruch Zicklin School of Business. Alex's career path has pivoted several times, first starting out working in graphic design, then he moved to the finance sector, then entered e-commerce, then marketing. He is now working in analytics and project management consulting at L'Oreal USA, while serving as the managing partner of a commercial real estate LLC based in Dallas, Texas. Thank you, Alex, for joining us this evening.
Thank you for having me.
Now, third panelist, he is having a little technical difficulties. We're hoping he can pop back into the chat soon. But Steve Hemraj graduated from Baruch with an MPA in 2014. Originally from Guyana, Steve fled his home because of the persecution of his sexual orientation. Seeking asylum in the US, Steve had worked for 13 years in banking and 3 years in manufacturing and television broadcasting before arriving in the US. And Steve is a public health professional with 17 years of healthcare experience with expertise in HIV education and prevention. So thank you all again for being here this evening. So let's get started by going back before the pandemic started. Can you each share your professional history and what you were doing at the start of 2020? Alex, let's start with you.
Sure, thank you. So before the lockdown, before anything, I originally came out of into college as a graphic design student. The industry at the time, this was 2004, really was being undermined by new systems and new softwares. So I decided to come back to Baruch to get a BBA in finance, which led to an opportunity to work in HR, finance for a company, and then led into an opportunity to actually do more marketing work. And my boss pretty much said, Alex, you have a knack for marketing, you should pursue that. So from that, I went into e-commerce and then strangely enough into analytics. And that pivot was mostly because I was sort of wrangled into doing something I wasn't trained to do and then had to train. But interestingly enough, with analytics, I discovered how it marries into graphic design in that it's not enough that you have the data, it's you have to present it in a way that people who don't know data can understand it very well, which is actually what graphic design is, which is to put a lot of information very succinctly. And then came an opportunity in end of last year to actually join as a managing partner for a commercial real estate LLC. Again, another industry that I have almost no experience in a country that's in a city that's 1,500 miles away. But it was a learning experience and brought all the the knowledge that I knew previously to bear into this. And then very recently had an opportunity to become project manager at L'Oreal itself. Again, bringing all the pivoted experiences that I had to bear.
Great. Noam?
Yeah, so in 2020, I was working for Promontory. Promontory, it's a financial services consultancy firm that specializes in compliance and risk management. I was working for the quantitative services practice there, and my engagement there focused on model governance, which is what I'm currently doing, model validation, and anti-money laundering. And actually, I was even starting looking a little bit before, like around January, when it just started. The pandemic just started far away before it came into the US.
Great. So how did your former employers respond to the COVID-19 pandemic? And just a follow-up to that, do you wish that they would have done anything differently?
I think what my previous employer, Scholastic, had done was pretty much the same as all industries. And it all varies depending on the industry itself. Their business model is based on schools and schools being open. So once those closed, things were hit hard. Whereas I think in different industries, they would have different strengths. Like L'Oreal, for example, cosmetics is not an essential industry, but pharmacies are, and cosmetics are available in pharmacies. So there's what the lockdown has done, I think, is really illustrated how one big event could have very different reactions to very different industries.
So for my company, first of all, as I mentioned, it was a consultancy firm. So the working environment in general is you either work from home or at the office, unless you need to be at the client. So kind of inherent to it is being mobile. So for example, I always had a laptop. I never had the big screen. So we were kind of by default mobile. And actually for most of us, the default was working from home when we don't need to be at the client. But once the pandemic hit, there was just not an option to go to the office. Everybody needed to work remotely, and no traveling to the client. So that was in general. But to my personal experience, has not yet the transition has been very smooth because I didn't need to be at the client side even before that. So for me, it was, I don't want to say business as usual, but the day-to-day work environment has not changed.
Right, it's just been in the same environment. So speaking about former employers, just implies now that you're working in different fields, different careers. What were the factors that pushed you to explore these new opportunities?
Well, for me, basically, it was a downsizing that happened in Scholastic at the end of 2019. So my layoff story was actually before COVID actually hit. So for me, it was sink or swim. And at the same time, I don't think I would have decided to become a managing partner had I not sort of had this sort of like, what do you've got to lose kind of situation. So I think for me, pivots can happen when you're not burdened by 40 hours of work, when you have suddenly a lot of bandwidth to actually reconsider your career. So I think in some ways, my opportunity just came from a crisis actually, and It's interesting. I think the Chinese character for crisis is the same as opportunity, two sides of the same coin.
No, I'm not.
From, so I was actually started looking a little bit before the pandemic because I wanted to focus on model governance, and that was just not the direction that my previous company was heading. So I started looking even a little bit before, but actively looking starting January, February, and then kind of the COVID hit. So the COVID was not the driver for the change, but it definitely changed kind of the process and the characteristics of the job search and the interview process, etc. Right? Everything was remote, no in person. So that was a job search I haven't experienced before.
Mhm. Now, you just mentioned that you wanted to make a transition to a new kind of area. What interested you in that area, in that part of your career? For you, Noam, specifically.
Yeah. So I think as I mentioned, what I wanted to focus on, which was very interesting for me, is the model governance. And I think one of the reasons why I really enjoy working in that space is because it allows you to work with so many stakeholders in the company. So you need to work with the developers, you need to work with the validators. We need to go with model risk management because at the end, model risk is part of risk, the big umbrella of model risk, and then at least at Citi, it's the smaller umbrella is operational risk. And there's like so many people involved and stakeholders that you need to kind of work together with. And this is one of the things I really enjoy, because the other project I was working on were very like techie, and you sit with your desktop and you need to do the work. And don't get me wrong, I don't underestimate it at all. This is it requires a lot of skill to do that, and I don't want people to get the wrong impression, but just it was less interesting for me, because with the model governance you can collaborate that with the interaction with the people.
Mm-hmm.
And actually also really change the processes, because when you work on governance, it's just validating the model. You create the policy that oversees this whole process, for example. Right. So it's also like a higher level than the more kind of hands-on analysis.
Right. And just before we move on to our next question, we've gotten Steve back into our room here, and we'd love to have him just update us. I'll just go through just one or two questions, Steve. If you can answer for us. What were you doing before the pandemic hit, and what made you want to explore a career change? Oh, you're muted.
So I was very fortunate to be one of the only manager from my organization, which was Bed-Stuy Family Health Center, to actually work from home and supervise a team working from home. Mm-hmm. My team is they are case managers who had to follow up with patients. I've never supervised 10 people working from home, much less we did not have the technology, the access to secure technology, or everything that needs to work. What I did learn is a great deal of experience. My mother, mommy. So I'm sorry about that.
No worries.
So one of the things that I learned during that time was all the mistakes I made, or all the things I made a checklist, and what it did is to give me an opportunity to create a checklist for myself of what needs to be done. Now, based on that experience and all the webinars and Zoom and everything that the people were doing, I realized that healthcare is going to be transformed completely. There is going to be a lot more remote work, because I've worked in healthcare for 18 years and I've seen the level of redundancies. And organizations should have been, before COVID, make the system more efficient. Now, we have 4 generations of people in the healthcare and the workforce. We have the baby boomers, you have the people like me, then you have the millennials and the Z. All 4 experiences have different experience of their lifetime. The largest block of people entering the health system are the millennials, who were born knowing that a smartphone is everything they have. And if you were to leave the smartphone home, that day were going to be miserable. Yet our healthcare system was never geared towards the technology for people to access care. The people in my generation, we would like to go and meet the doctor and say good morning. We want a good morning. But the millennials, they don't care about whether you say good morning or not. They want to be registered before they go to the clinic. When they hit the clinic, they want to be in and out. Because everything for them was at the touch of their finger. And I had a difficulty explaining this to all the baby boomers who are executive directors. Healthcare is not the same before March 20th. And so I left my job and I am in the process of a startup. Basically, the way I am going to be doing the care model is to be able to help get people in the community who are not in care, basically to look at their physical, mental, spiritual, not religious, spiritual and economic health. And I would leverage the community resources to make that process happen. And I will be controlling that entire linkage navigation to care, where the economic piece has to be in place, because we talk so much over the years about the social determinants of health, but we have never put practice or a model in place that address it. And so that is what I'm doing in the startup right now. And I'm fearful, but I am hopeful.
Well, Stephen, my next question for you was going to be, how did you react to the pandemic? But I think what you've surmised and what you said was to create a new healthcare model and bring it into the technical world.
Well, the pandemic really was very personal to me. I had 2 cousins from the same mother who died 1 week apart.
Wow.
And so we couldn't go. It changes our life. You couldn't attend the funeral. And even during the time where we were connecting people, there were a lot of clients from the organization who are primarily HIV positive, substance user, alcohol. And it was a perfect opportunity for people to relapse. They have nothing to do or knowledge to do it, and alcohol was had hit the highest sales ever in the American history during the period of pandemic. So there was a lot of issues. People were hungry, they could not get food. People didn't, because this was all of a sudden and we locked down. So the experience is very bad. And it's personal to me. And I did not leave my home for 40 days. Because my mother is 82 years old.
I think a lot of people can relate to that.
My mother's 82 years old, who lives with me. She's diabetic and hypertension. If she gets COVID, God forbid. And so my lifestyle had to change completely. And so my lifestyle had to be completely changed in order to suit her. Even though I go outside and I'm very careful about doing all the risk reduction procedures, you can never be 100%, because this virus is deadly, dangerous, is nothing like the flu, and that is what is causing it. Now, from a medical standpoint, where I'm coming from, we see a lot of young people walking around the place without a mask, and we believe that the young people are not going to be affected. What they're seeing now in the younger people, because it affects your blood vessels, these young people are going to have stroke.
So let me just just pause you there, Steve,
Yep.
because I think we've reached the point where we should talk about the challenges that you all are facing. So I just want to pose this question to everyone on the panel. What are the biggest challenges in your fields at the moment? Alex, let's start with you.
I would say it's coordinating efforts and getting enthusiasm behind projects when you're not physically there to pitch or to pivot. We're trying to persuade people who don't have the bandwidth to do a pilot or a proof of concept to make time. And I showed up on July 15th and they don't know me from Adam. So I have to sort of, it's also figure out office politics remotely. It's how to knowing what minefield not to step on. I think the entire process of, there's so much about working remote that has made us more efficient. The time that we spend commuting is time that we can use for ourselves now. We don't have to, wait for an elevator to get to a conference room. We can just jump from one MS Teams meeting to another. At the same time, there's a lot of human disconnect, and I think that's starting to, in some ways, that reflects on how people work. Other people really take it in stride and just see that a face-to-face camera conversation could be no more different than meeting across a table. But for others, I think it's sort of hard to get enthusiasm out of people.
And Noam, for you?
So first of all, I think there's a lot of uptick in work in many areas, especially in the model space, because many of the models don't really operate as expected under such stressful conditions, and many of them require some tweaks, redevelopments, and it just results in a lot of work for our team. So that is the one thing that may be specific to the model governance and model risk management space. Another thing, maybe more semi-personal, is that because we work from home, there isn't really the separation between like work and personal life. So I'm always like in a work state of mind. My personal computer is also my work computer. It's always in front of me. It's always there. I think I probably work more than I would have, if I needed to go to the office, because it's just there. It's so convenient, and just another email. And so that, I would say, maybe another challenge. And as Alex mentioned, I do miss the human interaction, and sometimes I think it can help with the efficiency of the work. Sometimes you want to point this or show something that it's sometimes much easier to do in person, and also like the built-in relationship that is much more difficult to do remotely.
Right, right. And Steve, what are the challenges you're facing in this new kind of entrepreneur space that you're in?
So the first thing is, it presents a lot of opportunity from a healthcare standpoint to be able to work from home. However, as you just see, there can be, if you don't have a space that you can properly work from, you're going to have distractions. And so it requires a lot of self-discipline when it's working from home, even if it's your own business. Mm-hmm. So as an individual, it requires you to continue to maintain discipline and not to have distractions. So you need to have your secure space with rules and so around the house that you're going to do that. The second thing is, all of these platforms and all these technologies are new to people, and the way to use it. For example, my video just now was upside down and I'm trying to show off I got this new fancy computer and I still couldn't operate it. So and I agree with Alex that the human interaction, physical human interaction doesn't exist. But I feel that there is an opportunity to become closer with people. Because one of the things I start doing as a social experiment is every Saturday at 1 o'clock, I told all of my nieces and nephews and cousins from all over the world, from France, French Guyana, Guyana, Trinidad. We're gonna have a Zoom call and we're gonna just check in. And my mother is here, and in order for her to see her grandchildren, she would have had to fly to different countries.
Mhm.
Now she's able to see all of them in one place. And it's because it's so close, you feel like you're touching the people. You're much more close. The second thing is you don't have to travel. You don't spend 2 hours traveling and then you're late for your appointment to tell you to, oh, you're late, you got to reschedule, or you got to hustle to get there. You can have an appointment at home. My mother, and I'm using my mother, she's 82 years old. Because she is in her space, she speaks more to the doctor than when she's in the office. However, the less physical interaction, if you do not have teleconference or video conferencing for your medical or any intervention or the work that we do in healthcare, you could be breaching a lot of HIPAA violations and not being able to connect with your clients. But the opportunity is you can connect with your clients through their, because most of the clients who are diabetic hypertension are going to be the over 50, 60, the baby boomers. How easy it is to teach the client, those clients, to use or be comfortable using a smartphone to get on. So this is why I might the opportunity that I'm getting into, that the model of care is going to be engaging their family and caregivers into that care. But the challenge basically is the use of technology to get the work done.
Right. So let's talk about, can all three of you share, just like Steve has shared about those 2 o'clock Zoom calls, how are Alex and Noam, how are you coping with this new pivot to working at home and kind of at Noam, as you said, having work be part of your life 24/7?
Um,
I'm sorry, Alex, go ahead.
Thank you. No, I completely agree with Steve and Noam in that there is difficulty in separating personal life from professional life. Um, and that's something I actually noticed in those times where I did have to work remote prior to the lockdown. If I was out of state and I worked remotely at the time, it was sort of very difficult to sort of vision myself clocking out. Now I have to, as Steve had said, set up a routine, set up a discipline, because my apartment is just full of distractions. And one of the things I do is I take my laptop and I actually leave. And I either connect to a Wi-Fi outside or to have my phone with me, connect to a little hotspot, just to have that sort of get out of your environment, get out of your home sort of scenario, be around other people, so to speak, and knowing there are other eyes on you to sort of keep you in check. I think those sorts of things really help, especially if I have to sort of like bang out a deck and really sit down and buckle down and focus. It doesn't help to be in one's home, even if you live alone. I can attest to that. That there are distractions all the time. So I would say that would be my difficulty. It's maintaining discipline and maintaining a work-life balance.
Yeah, Alex, I second Alex, and it also relates to what I said before. It's difficult to have this balance, and I think routine on the other side is, for me, is I try to have like a time at which I said, okay, now I turn off the computer, I do something else. I try to go outside or something to get out of the home that is also the office. But I would like to bring a little bit of positive to this whole environment, is that on the other side, at least where my computer is, it's just next to the kitchen. I also have a small apartment, so the advantage of that is during meetings, sometimes I can just make coffee and get something to drink, get something from the fridge. Something that is much more difficult when you're at the office or in a meeting, etc. So there's also a lot of flexibility with that. It is something that I welcome.
So in this new space, I feel like we are all learning different ways to cope and different ways to do things. And just circling back to pivoting, experts say that one of the challenges people face in switching careers is a skills gap. When you were making this transition, did you experience this? And if so, how did you navigate that?
Should Steve go on?
Oh, yeah.
Yep, Steve, you can go right ahead.
So I started off in banking, and then when I got to this country, I switched completely to healthcare, and I've been doing healthcare since. So I'm using everything that I've done in my life, every area of expertise, from banking to finance, from project management to case management, clinical operations. I'm taking all of that knowledge and bundle it into one experience to do that. So I'm using my past experiences into this business because they are transferable skills. And most of the time when we are reluctant to go into a different industry, or we don't consider our transferable skills, and you got to be able to use that. And that is what I'm going to be using. And so I'm not scared. It's a time when it's just to be able to convince people, because I know I could convince people financially, especially, look, there's no cost to you for me. You're going to be paying me for my production, for each client that I bring to you. And so if I'm linking those clients to other services, those organizations are going to pay me because they had to hire an outreach worker to do that. So what I'm doing is going to be all of those things that you don't have to pay employees full time. And I could even go further and say, take on those non-essential roles, like calling people to make appointments or get them to confirm appointments. Those are things that could be done remotely. And so there's going to be a lot of real estate that is going to be free in the next coming years.
Noam, how about you?
So first of all, I would just like to elaborate a little bit of what we mean about a skills gap. So I think a skill gap is when you move from, one position that requires a certain set of skills to a different positions that requires a different set of skills. This is when you would have a gap. So first of all, I'll start with myself. So I didn't have that much because I was looking for a position that was within the area of my prior work skill set. But I think in general, the reason why you probably bring it up during COVID is because many people need to move from a certain position with a certain skill set to a different one, because either there's a lot of laid off, or there's a lot of change in what is currently the industries that are being hired, etc. So I think this phenomena that is not necessarily unique to COVID just manifests itself much more during this environment. So again, I don't think it really applied that much to me, but I think to do bring something to the audience that may be of value is, just like every time when you move a job, you always need to think of, as Steve mentioned, of what is transferable, because at the end of the day, your new employer only cares about what you can bring them. They don't care about what you did before unless it's useful for them. So this is just something to keep in mind. I mean, I think it's always good to keep in mind in when you look for a new job, but in particular right now when you move to a significant pivot in your career.
Alex?
Yeah, I completely agree in terms of what Noam described about skills gap. The categories of them is very, very true. It's one thing to go from finance to healthcare, to literally to go from being a banker to being a physician's assistant. But there's so many skills that are transferable. For example, for this project manager position, and this may be for for people who are on the transition right now. I don't have a PMP. I don't have Agile certification. I'm not a Scrum Master. I don't have any of those skills. All I did for my interview was basically tell war stories of all the other projects that I've been on, and all the cautionary tales that occur. Did I know exactly the kind of software that they were implementing? I did not, but I knew the human factor, which is you have to herd cats. You have to corral people. And if you have experience in that, those are very transferable skills. And those are skills that can go into so many different industries, whether it's project management or just, or in any other industries where the human factor comes in, where you have to be a psychologist in some ways. So I would say don't underestimate your own skills, because you'll be surprised how transferable they are. And oftentimes people don't hire for skills, they hire for character, and they hire for your hunger to learn.